Hello everyone, my name is Dr. Raghu Nagaraj. I'm a senior consultant orthopedic surgeon, knee and shoulder specialist with particular interest in sports injury treatment and joint replacement. Shoulder dislocation is one of the common and a major problem in young athletes, particularly who are involved in overhead sports like basketball, volleyball, badminton and tennis. Shoulder dislocation is nothing but when the ball of the shoulder joint moves out of its socket and comes back. Shoulder joint is a ball and a socket joint. For the ball to be within the socket, there are certain strong tissues which keeps the ball in the socket. This is called labrum and capsule. The risk of shoulder dislocation is very high in athletes who are involved in overhead sports, particularly when they have to take a smash or when they hit the ball with overhead movement. So during that movement, the ball forcefully goes out of the socket and comes back. So when it does that, there will be a tear in this labrum and the capsule tissue, which results in further repeated episodes of dislocation again and again. Once the shoulder dislocation happens in any athletes, so the athletes loses their confidence on the shoulder. So they start hesitating to do the overhead movement. So that impairs their performance and their sports career. So shoulder dislocation should be evaluated. The moment dislocation happens, any athlete should come to a clinician or a sports medicine surgeon to get evaluated. So when we examine these athletes, so we will see certain criteria or certain factors which has led to the dislocation. Most of the time it's the trauma that causes this dislocation. But in certain individuals who are born with a ligamentous laxity are predisposed to this dislocation without any kind of trauma or with a small amount of trauma also. Once the physical examination is done, we'll subject them to certain diagnostic tests like X-ray and MRI and CT scan to evaluate the extent of the soft tissue damage and bone damage in cases with multiple episodes of dislocation. Once the evaluation is done, then we'll plan the treatment for them. Athletes with first episode of dislocation is always treated by conservatively with physiotherapy and following rehabilitation. And once their strength is regained and once their apprehension is gone, we'll subject them to training and subsequently return to play. In patients with multiple episodes of dislocation need surgical intervention as they don't respond to physiotherapy. Surgical intervention involves arthroscopy or a keyhole surgery where we'll make a small holes around the shoulder joint and pass the camera. It's like a pen camera. Once the camera goes, looking in the camera, we repair the labrum and the capsule tissue which is torn away from the socket. We have to put a small clips which will be like a size of a 2.8 mm in diameter to regain the stability back. These clips are generally made up of bioabsorbable implant which is self-dissolvable. Patients with bone loss more than 25% of their native bone requires a procedure called arthroscopic lethargy, where a bone graft is taken from the neighboring bone and transferred into the socket so that to increase the width of the socket and to get the stability back. Generally, in athletes with multiple episodes of dislocation, arthroscopic Benkart repair with a repair of the cuff tissue on the backside to fill up the Hill-Sachs lesion gives excellent results. Only in special cases where the bone loss is too much, those cases this arthroscopic lethargy is advised. Recurrent dislocations of shoulder joint is a very common problem and it should be addressed carefully to help the athletes get back to their sports in their normal way.